I'm Dr. James Marcum, and I want to welcome you to the PlantPure Summit 2016. And this is a convergence between plant-based nutrition, modern healthcare, and lifestyle. Glad you joined us. Before I go on, I want to introduce yourself. Many of you don't even know who I am. Well, I'm a cardiologist that practices every day seeing patients in my office with the Chattanooga Heart Institute. And my journey to plant-based nutrition and integrating healthcare with lifestyle started many years ago. In fact, I graduated from medical school at the University of Texas, did internal medicine at the Medical Center of Delaware in Wilmington, and did my cardiology training at the University of Kentucky. I've been practicing with the Chattanooga Heart Institute since 2001. And I saw every year patients coming back with more disease, more problems. And I began looking for answers. And a few years ago, I read the book, The China Study by T. Colin Campbell. And I started studying and integrating some of these principles into the practice of medicine. And guess what? Patients started to get better. As we move on today, we have a special guest that we're going to be interviewing in a few minutes. But some of the challenges we have is, first, in working with patients every day, one of the biggest challenges is getting patients to understand why they're sick in the first place. And what I try to introduce them is to the concept of stress. You know, when we have stress on our body, there's chemical changes. No matter where the stress comes from, the chemistry is about the same. We turn on adrenaline, cortisol, inflammatory markers, and these chemicals long-term can change our very genetics. We can modify our genetics by how much stress we're under. What kind of stress we might have? Well, some people can see the obvious stress like chronic pain, but there's the hidden stressors. Not getting enough water, not getting enough sleep. We know about the nutritional stress that people bring into the body, not having the right nutrient composition. We know when we bring in more than 10 to 15% of body fat is what we need in our bodies. When we eat more than that, guess what? That fat is stored. Storage of fat can lead to chronic disease. Some people bring in too much protein. That can also lead to chronic disease. And that food is a major stressor we see, but it's also, in our day and age, we have a lot of mental stress. We were never made to be going 24/7. We were designed to rest at night. We were designed to rest one day a week. We were designed to do these things. And as we broke away from these patterns, guess what? More stress on our body. And if that wasn't enough, then there's modern medicine. Modern medicine can be a stressor. We weren't necessarily made to have medical medicines in us. We weren't necessarily made to have all these procedures. So I try to first introduce the concept of stress to my patients. The place for modern medicine, I tell them, is to treat a symptom. If I'm having a heart attack, I want a stent or a bypass. If my heart's going too slow, I want a pacemaker. If I'm bleeding to death, stop the bleeding. If I have an infection, let's treat that. And the next step when the patient comes back to the office is I talk about, well, what caused that? What caused our body to age? What caused damage to our genetics, the stressors that causes all sorts of disease and eventually symptoms and eventually the need for modern medicine? Then I start going through the list. You've had your heart attack. Well, what are your stressors? How are you eating? How are you thinking? What about your genetic stress? Are you resting well? Do you have pain in your body? Do you have unresolved conflict? Many people call what I do as the cardiologist as a behavioral cardiologist because we've learned that our behaviors change the way we are. So I try to deal with the stress a person might be under one step at a time. So you can see relationships are very important to what I do. Unfortunately, in the world we live in, sometimes we're so busy in the office that we can just treat the modern medicine part. We just treat the symptom. We never have time to get at the cause. So I can't answer all the questions that you might have, but I want to introduce this concept of stress. If you're a patient out there with disease, are you having active symptoms? If you are, that's the place for modern medicine. Once your symptom has improved, then I want you to ask yourself, well, what are the stresses I'm under? Am I under food stress? Am I under mental stress? Do I have chronic pain? And how does these variables interact? Remember, this chronic stress makes all these bad chemicals. These chemicals in studies we've shown actually changes the DNA itself. The telomeres actually shorten. The DNA mutates. All sorts of bad things happen. We begin to age. So our goal in treating the chronic disease is to decrease the stressors. And I'm not going to talk a lot about a whole food plant-based nutrition because we know how important that is. I frequently prescribe greens and specific foods for specific symptoms because we know that those foods change the chemistry of the body. I give greens to help make nitric oxide. We might use foods like beets to lower blood pressure. We might have other different specific foods we use to treat the body. I also might tell them of the bad foods that stress the body, like lots of meats, eggs, cheese, those type of things, lots of chemicals, how our body doesn't know how to deal with them and it puts stress on them. So that's some of the challenges we have. And as a physician, a lot of my partners are great at treating the modern medicine, but they just have not been educated on how to treat chronic stress. They don't think a whole lot about the cause of disease. So I want you to think about your cause of disease as you listen to this story today. Now, that's some of the challenges that we have is dealing with the chronic stressors, getting healthcare providers to address it, and understanding how do we do this. But in the real world, how do you tackle these problems? You know, a lot of people have eaten a certain way, that they think a certain way. We're used to this modern 24/7 news cycle. How do we break out of the pattern and of the havoc of chronic stress? What is the real solution? Well, I can't give the solution all at once, but I want today to start talking about one of the solutions I think that might be great for us, and that's the solution of relationships. You know, we were designed to have relationships. We were designed to be outside and not inside. We were designed to move and not to sit. We were designed to eat plants that grow and not all the processed foods and meats. We were designed to talk and not text. We were designed to be creative and not to be entertained. As we move away from those models, guess what happens? Yes, stress. A little bit of stress here, a little bit of stress there. Sooner or later, our body has lots of stress, our genetics change, and guess what? Sooner or later, symptoms develop. We go see a provider, and the provider treats the symptoms, but doesn't always get at the cause. If we can't get at the cause, chronic disease continues to grow. We see that in our society today. 1 in every $4 to $5 now is spent on health care. We see the rates of cardiovascular disease, cancer, obesity, diabetes, sleep apnea, joint pains continue to rise every year. Medications. Well, medication use is on the upswing and not on the downswing. I think people now are interested in answers. We're interested in raising this discussion to a higher level. And that's what the PlantPure Summit is all about. Getting speakers, experts in their field, sharing what they have, spreading this to your social media platforms, and letting people all over realize that there are answers to our chronic healthcare problems. This evening, we have a guest that's joined us, and this happens to be a friend as well as a patient of mine. Ellie, thank you for being here with us.
Thank you. My pleasure.
Did I wear you out with that discussion?
No.
Now, you probably heard parts of it in the office, but you know, doctors I just have 10 minutes with the patients, and you can't get a lot said in 10 minutes. But you know, I want to share with our audience, you know, I've posed some of the challenges we have, the place for modern medicine, all the stress that's out there, the disease that develops. Well, you know, I can't give the solutions, but we can share some relationships and testimonies. And I think that's very valuable because if you can change someone's heart, get them motivated, they can listen to more of these lectures. They can say, well, what is the one thing I can do? So tell us, where did your medical problems and where did it all start for you, Ellie?
Well, my journey started about 3 years ago.
Okay.
I went to my physician on a routine physical exam. And with my history of some autoimmune issues, he said, well, we went through top to bottom, and how's your heart doing? I said, it's good, it's ticking, I'm here, we're good. He says, you have any pains? No. Any shortness of breath? I said, no. The only thing I can think of is sometimes I just feel like I just didn't breathe hard enough or catch my breath. I just kind of feel And so he said, okay, well, we probably should look into getting your heart checked and having a stress test done on the heart.
Now I'm going to stop you there, so the audience might want to know. You're a type 1 diabetic.
Right.
Okay, so that's a genetic stress
Right.
that you were born with. So you're having the stress of all this lack of insulin.
Exactly.
Okay. so
Type
that's-
1 diabetes.
Now,
which
also I
was-
want to share your background.
Yes.
Now
I'm a nurse.
yeah, so you know all this.
Absolutely.
Okay.
I
Right.
was a woman in my 40s
Right.
with type 1 diabetes. And I also had another autoimmune issue with Behçet's, which also, again, is autoimmune. So, yes, that really alerted him to, we should check the heart. Let's see what's going on. Very reasonable to do. So we did the stress test, and it showed I have moderate ischemia.
Okay. Now the stress, did you walk on a treadmill?
Yes, I did.
Okay. Now did you remember,
It was-
did you have any symptoms when you walked?
No, I didn't.
So you felt pretty well.
Yeah, I
Okay.
did. I didn't feel I was healthy enough or strong enough to keep going, just muscle-wise, but I didn't have any symptoms. So I just
Okay.
kept going.
Okay.
When the results showed moderate ischemia, which means I'm not getting enough blood to my heart, he then proceeded forward to do a angiogram.
Now I'm going to stop you there. How did you feel at this point? You know, you weren't that sick.
No,
You get all this
no.
tests, and now they say something's wrong.
Yeah.
Now, how did you feel emotionally? Did it sort of shake you up, or?
Well, of course it did.
Yeah.
You know, I've probably been a vegetarian most of my life. I've eaten healthy. Because of my type 1 diabetes, I've really taken care of myself as much as I thought I knew to do. So I thought I was more than the average person.
Right.
So, of course, when he says that, that was a bit shocking. And I thought, well, tests are wrong. They can be wrong
Right.
sometimes.
So you sort of thought it might be wrong.
Yeah,
Yeah.
of course.
Okay.
Why not?
Okay. So yeah, no, this test
So-
isn't right. The doctors are okay.
That's right.
Good.
So I was really hoping that, this is the wrong findings here.
Now, did you share at this point? Did you share with your family about all this, or did you sort of keep this to yourself?
No, I did.
Okay.
I did. Just my husband, my mom, basically, and we scheduled the echo, the cath, pretty much right away.
Okay.
And I was still very hopeful at that point. I thought, no, we're coming out. It's going to be okay.
Okay.
Nothing's wrong. So we had a very good cardiologist do the echo, rather the cath,
Angiogram.
angiogram. And then he came out and told my family the results.
Okay.
But the nurse in me was awake enough to say, what was the result? And he said, well, it's okay. We'll talk later. No. Can you please
so
tell me
you
what
wanted
the
to know
result?
right now.
I want to know right then and there when I was still half sedated. I
Okay.
needed to know. And he told me. And I just, pretty much tears were running down my cheeks. I did not expect this.
Yeah.
Not in a million years.
Well, I'm going to share that because I don't want you to,
Yeah.
go over it. But I was able to review the angiogram,
Yeah.
and you had very small blood vessels, which is sometimes what we see in diabetics.
Right.
But we had diffuse disease in all of the blood vessels, and we had one artery that was really blocked that was causing the ischemia. And when you exercised, you weren't getting enough blood to that part of the heart, and we saw that on the nuclear scan that we originally did then. So what happened after that? What was the recommendations?
After that, they referred me to a surgeon, cardiac surgeon, and as you mentioned, he said the vessels were too small to really operate and put a stent or be able to do any grafts. He said we could try, but I don't think we're going to be successful in doing that. I said, well, that's certainly not an option. We're not going to do something it's not going to be successful here. So, of course, I was referred back to the cardiologist. And when I went in, basically he said, okay, you have cardiac disease, you have type 1 diabetes, this is what we do for patients like you. He put me on a blood pressure medication, another heart medication, he put me on a statin, and he says, you come in here every 6 weeks and you get your blood drawn, and this is how this works. You're part of this clinic now. And so I started asking some questions. I said, well, wait a minute, I run a very low blood pressure. He said, it doesn't matter. This is what you have to have. The nurse and me again. This blood pressure is going to bring medication is going to bring my blood pressure down.
Right.
It's almost like he wasn't listening. This is what we do for people like you.
Right.
You file in here, and it was really, really disturbing. Never once was I asked, "What do you eat? What do you drink?" I could be eating McDonald's 3 times a day for that matter,
Right.
And he didn't even bother to ask or hear, what's your lifestyle? What do you do? Do you sit on the couch? I mean, so anyway, I went home very disturbed with that. And I thought, okay, the nurse in me says, medicine, there's a place for medicine. Now I'm going to try all this. We're going to get on it, and we're going to do this.
Now I'm going to stop you right there, just to in medicine and cardiology school, we call it medical school. They teach us about medicines.
Yes.
I did not get anything on nutrition. I did not get anything on this higher level of stress in the body that turns on these things. We were taught to treat the symptoms. Now it's interesting. You really didn't have very much symptoms, and you had significant disease.
Yeah.
So we were potentially looking at a big problem suddenly.
Very quickly.
And a lot of people, the first time they know that they have heart disease is when they have a heart attack.
Yeah.
And that's scary. And what's concerning to me is that you have all this dumped on you, and the stress level must have been starting to, almost you were better off before you even knew.
Exactly. Ignorance was bliss
That's
at that
right.
point.
You almost were better off chemically before you knew this was even,
Yeah.
except that, there are some things that you could have done to help. And
Yeah.
so tell me about the medicines. How did that work out for you?
Well, not very well. Within just a week of taking the blood pressure, a few days, I was dizzy. I couldn't keep my balance. I had my own machine at home for blood pressure, so I was checking. I was very low. So I stopped the blood pressure medication. I continued with the other two, continued with the statin. About 3 weeks, I started having some muscle pains in my legs. And it got to the point, I think I was on it almost a month, and it got to the point where I just couldn't even walk. Quality of life is very important. And I thought, okay, I need to move. I need to exercise. I need to do some things. And the side effects of this are crippling
Now,
me.
were you still able to work at this time?
Actually, I was not working at
Okay,
that
good.
point.
So you're not working. Okay.
At that point, fortunately, I was not. I had already taken a sabbatical from nursing
Okay.
for sanity.
Okay.
So I...
Side effects, terrible.
Yeah, absolutely. It was horrible. The dizziness, I couldn't function. I wasn't able to function from the medication, and especially the statins. So I went back to my internist, family doctor, and I discussed this with him. And I said, what are we going to do here? He says, well, let's try you on a different statin.
Okay.
So we tried that one. That one took a little bit longer, more the 3-4 week mark before I started feeling the cramps again, the night cramps, getting up, not resting, walking around all night. And it got to the point where also I was having difficulty walking with the second medication.
Wow.
Yeah, I obviously didn't do too well with them.
Yeah.
So at that point, before I went back to him, I stopped and I thought, you know what? I need to look at something here. About 6 months prior to that, I started a program. We started a program at our church called Dinner with a Doctor.
Yeah.
It was a program to teach people how to take care of their health better. And one of our guests happened to spoke on preventing and reversing heart disease. Actually, that was our first lecture the physician spoke about. So, and when I heard it, I remember at that point hearing it and saying, well, that's nice, for people that have that, that's great. That's what they should do.
Yeah, that's right.
Little did I know, 6 months later, that was going to be me.
And I'm sure he talked about not only used to prevent, but also to treat.
Reverse.
Right.
Treat and reverse.
Key. Okay.
And obviously, the reversal is what got my attention. So I went back to the material, started digging up real quick, and started finding out where my resources are, getting on the web, looking at the book itself, Preventing and Reversing Heart Disease. So I started doing these things on my own. Started looking at the food, looking at these things on my own. And at that point, right within that week of me doing all of this, you had a book signing at a local bookstore. And I went to it, and I met you there.
Right.
And I sort of presented my case very quickly. And I said, I'm in the market for a different cardiologist.
Now, I'm going to stop you there before the market. So you went back to your cardiologist with all these complaints or these side effects. They weren't really complaints, they were side effects. Did they have anything to offer, or they would just say, no, this is the way it is?
I called a couple of times.
Okay.
I did not go back.
Okay.
Because I found
Because you felt like you knew what was going to happen.
Absolutely.
Okay.
I called and I said, I'm having this and I'm having this and I'm having this. Well, you just need to continue going forward with this medicine. I said, could you please talk to the physician and tell him my side effects? He got back with me. It was the same thing. You need to stay on your blood pressure. You need to stay on the statin. Okay. Despite the symptoms, I mean, it didn't make sense to me.
Discouraging.
Absolutely.
So I'm going to, try to defend modern medicine a little bit. We really weren't trained to deal with this. And that's a part of what this summit's all about. And this talk is getting people to have more knowledge. And I'm sure that doctor, if he would have known that there's other resources, we want our patients to be well.
Absolutely.
Sometimes we just don't know everything that's out there that's available.
Right.
So maybe that was the case in your case.
Okay.
So you're marketing for a new cardiologist.
Yes. When I ran into you,
Yeah.
and I explained my case, and I said, I really need to get in with you because I heard that you actually look at the patient as a whole.
Right. Now, Ellie, I wasn't always this way. I was trained in the modern medicine field.
Right.
It's only through study and people impacting me, like Colin Campbell, who's actually going to be on the summit, Dr. Esselstyn, who actually wrote the book that you're referring to, Reversing Heart Disease. They made big influences, and we're hoping that we can also influence other people to watch this and realizing, even if you don't know how to do it, at least have an open mind
Absolutely.
and have the resources to move your patients to where they can go and get help.
Right.
So we started on our journey.
Right.
So what happened after that?
Well, I mean, I did not have a choice.
Yeah.
One of my vessels was 96%. I was just a minute away from a heart attack, pretty much. And I knew I didn't have a choice. So I had to, gangbusters, just get on and do what I needed to do. So right away, I changed my diet, 180, total change.
Now, how did you do that? How did you learn how to do that? What was some of the resources? There's other people that might be watching that might want to know what you did.
Well, I started reading the book, Preventing Reversing Heart Disease by Dr. Esselstyn. And I got on the website there that told you, and they have a lot of blogs.
Yes.
A lot of blogs that were very, very, very useful to me. Practical stuff. Other people like me that have done this and tried this, and so it was pushing my greens. I found out on there the biggest greens, my kale, my broccoli, my spinach was huge. No oils, no fats. At that point, I cut out all fats because I am trying to reverse some of this.
Right.
It's not I'm trying to stay healthy and I'm fine. I'm trying to reverse this. This was a pretty acute situation for me. Also, no preservatives, no additives. Didn't realize how huge that was. When I went to this, I was feeling okay, other than emotionally shook up at that point.
Right.
But I was feeling worse for almost a month. I think I was detoxing. I started feeling really bad for a good month, I think, before I started seeing some turning around in here. And then I started seeing you around that point. And you've encouraged me not only to stick, this is what I needed to do. I didn't have a choice. I have to do the whole food, the plant-based, the greens, whether it's the smoothies or the chopped, God bless my mother. She couldn't keep the kale washed enough and just chopped up and ready to go for me. And you find out different ways to make it and do it too. You can use a lemon juice. You can use some balsamic stuff. You don't have to have the oil.
Right.
It's all about changing our taste buds and training ourselves to do things differently.
So as you started learning and making the changes one step at a time, how did you feel? Did you notice any physical changes?
Yes, after I got through that acute month of just kind of feeling very yucky and looking back, I think it was just my body getting rid of all whatever. Oh, absolutely. I was diagnosed with fibromyalgia also a couple of years prior to that. My pains, my aches in my body, they weren't there. Wow. It was amazing. Within probably about 4 months into this, 6 months, I was feeling I had more energy than I've ever had. And that's huge. The aches and pains were gone. There was feeling lots of things, just physically feeling
so
very
your
healthy.
autoimmune disease was also treated by this
Absolutely.
lifestyle change.
It was quieted down. All the symptoms of that were very quieted. In fact, I've not had a flare-up with my Behçet's since that point. So it was very interesting.
So your stress level must have come down too, realizing that you can do these things.
Yeah. At first, it was stressful trying to do it.
Yeah, okay.
It was very stressful.
Okay. And what made it stressful? This will be helpful because other people are going to do this. What made it stressful, and what could we do to help others maybe lessen that stress?
Well, it's new.
Okay.
To me, because it was life and death, I needed to act quickly. So I think if you're in a different situation, it wouldn't be quite so stressful perhaps in the beginning. But I needed to do it quickly, learn it quickly, and I think that in itself was stressful for me.
You know, and for many that come into my office, they've never eaten this way ever.
Right.
So it's stressful just dealing with their friends and family.
Absolutely.
What are you doing? You can't do this. This doesn't work. You can't be happy. What do you mean you're going to give up eating your steak and your hamburgers? You can't do this. And it's a lot of peer pressure sometimes.
Absolutely.
Yeah.
Well, I've had family tell me, "Are you stupid? You're going to die. You can't just eat greens all
Yeah.
your
Oh, you don't
life."
get enough protein. You don't. That's one you hear all the time. You don't get enough protein.
Yeah. Yeah.
Well, you don't look like you're dying.
Exactly.
Right.
And trying to convince them that I'm feeling the fittest I felt in a very long time. I feel great.
Yeah.
I had to do what I had to do regardless of them. But it is true.
Right.
It is true. I didn't go out to eat, I think, for almost a year.
Okay. Well, that was probably good. So it may be hard for you.
Yeah.
Until you were really strong mentally.
Absolutely. And know what to eat and know what to do. I mean, it's a process. This is not something that comes overnight. You have to be very intentional. You have to want it. I mean, I want to live. I want to have a good quality of life. It's not just about surviving with heart disease. It's about actually having a good quality of life and not symptoms and having a full life.
So did you start doing exercise and things of
Yes,
that
I did.
nature? Okay, how did
I
that go?
started slow,
Okay,
as you told me, slow. But one foot in front of the other, started walking, and you can increase that. Get up every hour and move.
there you go.
Don't sit.
There
Don't
you
become
go.
a couch potato. Your famous words. Get up every hour and move.
Yeah.
Do not become a couch potato. And I did. And the better you feel, the easier this becomes.
Okay.
So
Well, Ellie, you know, after we doing this for 3 years, we went and checked your cholesterol. It was beautiful. Some people do benefit from cholesterol medicines if they don't have a side effect.
right.
But the side effect of the medicine on you was causing stress, which caused more damage than it was helping.
Correct.
So anytime a medicine causes more stress, then it's time to get rid of it.
Absolutely.
And yet we have these large commercials, modern media saying you have to do it. No, there's never been studies that have shown the stress that these medicines cause and if they're a benefit to a person that's under stress.
Absolutely.
And that's what I think we have to remember is no, there's rules aren't the same for every person.
Statins I was on, of course, the nurse in me, I'm just looking at all the stuff, looking
Yeah.
at the side effects after I started having them. I said, this is normal. I started looking. And one of the things it said, it was only effective in 30% of the patients. So I thought, okay, even if I was not having these symptoms and I was taking this medicine, what if I'm one of those 70% that wasn't helping? What else
Right.
am I going to do?
Right.
I'm just going to pop the pill and was it covering me or not? Was I one of those 30% that was helping or not? That was a little bit disturbing to me too. I thought, it needs to be a whole picture. It's not just the medicine. What else can I do in my lifestyle? There is a connection between what we eat and our health and what we are in our diseases. I mean, there is a connection there, and we just don't tie it together sometimes.
Yeah.
Like if you have type 1 diabetes, there's certain things they tell you to eat. Well, how come when we have cardiac and heart issues, we don't?
Right.
Right.
So you learned a lot in a short period of time because you had to.
Absolutely. I had to.
And it sounds like you had some good relationships and some not so good relationships. Now, a few months ago, we decided to repeat the stress test. So we repeated the nuclear scan, and in the area of the anterior wall of the heart where that severe blockage was, all of that heart was now getting enough blood.
Yeah.
And you walked pretty well on the treadmill, and you didn't have any symptoms.
Yeah.
That was very exciting, not only for you, but for me, because I've seen this happen over and over with patients. The research that's been done by Dr. Esselstyn, Dr. Ornish, and others have shown this. It's now time for large, controlled trials to compare this type of treatment in heart disease. And I think we're one step closer to that day. But I was very excited when I saw this. But at the same time, there are ups and downs to this. So have you had any, you talked about all the ups, there's got to be a few downs. And what do you do when you do have a bad day?
Yeah. Well, it's kind of like falling off a bike. You got to get right back on. Yes. Has it been perfect all along? No. I had to be very intentional the first year, but then you get to a little plateau sometimes, and it's like you're tired. You're just tired. And so you do eat something because you haven't prepared ahead of time, And I did find myself getting off a little bit and eating some stuff with preservatives and additives to it, and perhaps missing a few days of my greens. And, it's funny. It didn't take me long to realize I started feeling a little bit bad. I started getting some pains back and some aches and pains. And I thought, why am I hurting? And then I realized what I'm doing. We're not perfect humans, but we have to persevere, We have to, this is what I have to do. I don't have a choice here.
Right.
I'm going to fail. I'm going to allow myself to do that. I'm not going to stress myself over that because that's not going to help.
Right.
So we just get right back up, and I just get up the next day and say, okay, today's another day. That was yesterday.
It's gone.
Yesterday's gone. We're going to start today again. And I've done that. I mean, it's not been perfect all the last 3 years. But, I've certainly tried as much as I can.
But it's a trend, one step, one day at a time.
One day at a time.
Well, Ellie, I think that's an important point I wanted to bring up to our audience today. We've talked about the stressors and the plant-based nutrition, but it's, a lot of nutrition decisions come with our brain. And as in our brain's under stress, the brain just wants to be safe. And sometimes we make bad choices when we just want to be safe.
Yeah.
And the stressors all around us contribute to our eating. So we have to control all the stressors, whether it be not getting enough rest, the relationships, pain in the body, maybe not exercising, stress, maybe sitting too long, maybe watching the news too much. A lot of people watching politics these days.
Yeah.
That stresses me. So I turn that stuff off now. I don't want to be stressed.
Yeah.
But it comes from many different places.
It does.
And then we want to deal with stress. And some of us, like me, I'm a stress eater. When I was in medical school, staying up those late hours, when I was tired, someone gave me a hard time. Guess what? I wanted something, yummy to eat. That's how I dealt with stress. So it's a learning process where you have to teach yourself all of this. And it's a real, those that are out there listening, it's just one step at a time. But I do think, the one thing I want to leave people with today is the concept of stress, how it damages our very core. A big stressor is food, but there's other brain stresses and other stresses out there. And the importance of relationships. Getting a team. I know you've had a family that's very supportive.
Absolutely.
And now you found the right people that can support you, and you've stepped out on your own and you're learning. And I know you're also strong in your faith. Now tell me, now when you've been helping with dinner with the doctor, I bet you do that with renewed vigor now.
Absolutely. I gave my story. I shared my story with some of our attendees that come, and it's helped them. We've had many people that get off their blood pressure medication, lose quite a bit of weight, get off of their type 2 diabetes medications that they have, just simply following these guidelines of whole food, plant-based. Yes, it invigorates me, excites me to see that results do happen. It's just not in the textbook.
Yeah.
It actually happened to me. I've also had to learn, though, it wasn't just the food.
Right.
I had to deal with the stress. I had to realize I need to rest my brain every day. I needed to walk, get physical activity every day. And that's a choice. You have to decide. You get up every day, I'm going to do this, I've got to do this, and I've got to do that. Otherwise, it doesn't happen. I take time out for a quiet time with God. I meditate. I get quiet. And that's been my bedrock for me.
Yeah. Well, I just think this is wonderful, and we're going to have numerous speakers on the summit, and we're going to talk about different things, but I wanted to let them know that there are success stories. This is a real success story. There are many others, and each success story has a different solution. It's not the same for every person.
That's true.
And yet the challenges, the stressors, you pretty much are the same, and if we can identify them and figure out solutions, that's going to be our best bet. But I want to tell everyone today, relationships are important. Good relationships with your doctors, your families, with each other. Once we have those good relationships, our brain gets better, we can learn better, we can come to stories like this and be encouraged. And I want to thank you for sharing with us. And I hope this has helped you to realize something that might help your body do better. I want you to share it with somebody as you listen to all of these different lectures. Remember that as we deal with the stressors, especially the food stressors, we change our very genetics. We change them. They turn on good genes and all those bad genes. They turn. It just helps us, and we're learning more and more as time goes on. I just hope that as time goes on, this type of treatment will be mainstay. It'll be reimbursed, and it won't be ridiculed.
Right.
We won't be made fun by offering this and teaching people, well, what's the first step? What's the second step? And we have to have relationships to do this, because we have to get to know people. And we just can't say, well, here's the formula. If it doesn't work for you, tough luck.
Right.
And most of my patients, when they go plant-based, some can change right away like you did. But most from it's a journey, one step at a time. So just thank you so much for joining us.
Thank you.
And I want to thank
you.
you for taking the time to watch this summit. I'm Dr. James Marcum. And if you might have questions for me, I invite you to go to our website. And my website's HeartWiseMinistries.org. And thanks for joining us this evening on the PlantPure Summit.